Hello, this is Dr. Marzban from CIC, and today we're going to talk about the scenario that a patient comes and has the pain around the shoulder area and shooting pain to the forearm, and they come for different scenarios, explaining that they feel that pain and shooting pain after sleep exercises or some type of physical activity that they do, possibly at home or at work, and that it comes suddenly and maybe within a day or hours, and they have that shooting pain that goes down to the forearm. And so in that case, we're going to be seeing that what other symptoms the patient has, if there's anything going on with the neck or other part of the arm, at forearm, or the shoulders and the front and the back, and other things that might be helping us to diagnose the patient. But at the this scenario, with that pain, the shoulder shooting pain to the forearm, usually it is a case that a patient has a very tendinous area in the front and the side and right here, where there is a muscle which is called the coracobrachialis, and that coracobrachialis is a very small muscle that attaches to the coracoid process right here, and it goes down to the area right here at the arm bone, and it's a very small muscle that is coming from here to here, this area. And this muscle, which is very small, one of the major function of it is that it does the flexion of the shoulder, and not the elbow, but the shoulder. And there is a nerve that passes through that muscle right there, and that is called the musculocutaneus nerve. So we have the musculocutaneous nerve that passes through that small muscle, which is called the coracobrachialis. That muscle right here, the tightness, and however this muscle is being irritated, the patient feels the pain in this area. And sometimes it gives a little bit distribution of the pain to the side and the top and the front of the chest. But at the same time, this coracoid process that is part of this scapula, the shoulder blade, and this coracoid process has other two muscles attached to it. And one is the short head of the biceps, which causes the elbow flexion, and there's another muscle that goes to the chest area, that's called the pectoralis minor, which is going to be bringing the shoulder in as far as the rotation goes. And so all these activities of this muscle, combination of those three muscles, could be affected by the injury or irritation of this area right here. What we see usually is that people, they come either with a bad sleep after they wake up in the morning, or sleeping on the couch, for example, or they do the push-ups and doing the press, and that muscle right here, which is a small muscle, cannot lift up heavier stuff. And so if you put too much of heaviness as far as the weight goes, and then you lift it this way, and that is going to bring this muscle into so much of strain that cannot hold it. And therefore, this muscle becomes irritated in combination of this pec minor and the biceps, which are doing this motion as well. So it goes up and down to do the pressing and the push-ups, for example. And so all this muscle can be irritated at the same time, but because there is a nerve passes through only one of the three, which is called the coracobrachialis, that gives that radiating pain into the forearm. So for that case, we examine the shoulder area, we examine the area right here above the clavicle, which is called the thoracic outlet. We're going to see that if there's other things dealing with that symptomatic issue that the patient is presenting with. But that pain in the shoulder radiating to the forearm, it is due to these three muscles and the combination with the nerve that we just talked about. And so we do different type of treatments. For example, we do the interferential for an ultrasound for the inflammation. We use the VMS to release the tension on the muscle. We do acupuncture. We do the laser therapy. We do the soft tissue work, and we do different. We use different tools in order to get that symptoms away. And the cause of all the symptoms away. So if we take care of this area, the pain that radiates to the forearm can also be resolved. And but again, we always talk about the pain complication or complex, and if they become more irritated over time, which we call a chronic case rather than acute, and when it becomes chronic, then the pain diffuse out to different areas of the neck, back, and other areas of the chest. And so sooner the patient comes for the treatment, it is much better result that we get for that case. After this, I'm going to be showing you some PowerPoints showing the muscle and the nerve, and hopefully that would explain it a little bit farther. And hopefully you will enjoy that as well as knowing that what is going on and what you're up to. Thank you. All right, now we're going to continue to show you a few PowerPoint slides to make it a little bit more clear what we were talking about with the shoulder pain, and that radiates the pain down to the forearm, lateral aspect of it. And here we go. This is the coracoid process. This is the front view of the scapula or the shoulder blade. And this is the lateral view. It shows that this coracoid process is moving forward, and that's where that we palpate to see that if it is a tenderness in this area. This is the area that three muscles attached to that process, and that usually very tender in the case that we are interested in. And here is one of the three muscles. This is the coracobrachialis. It's a very short muscle right under the clavicle. And in order to palpate this area, we go below to the lateral aspect or outside of the clavicle, the bony structure. Right underneath, you will feel that there is the protrusion of the bony structure, and by putting some mild to moderate pressure, patient feels very tender in the area. So this is one of the three muscles that we talk about. And here are the other two. This is the short head of the biceps, and here is the cutoff of the pec minor. And this is our old friend, coracobrachialis, and it shows that there's a nerve that's passing through here. This is cutting off of some of the muscles. It shows that the nerve is passing through this coracobrachialis, giving supply to the coracobrachialis, the biceps, and this muscle right here, which is called the brachialis, and the nerve is just going down toward the forearm. So this nerve supplies all three muscles right here, the coracobrachialis, biceps, as well as the brachialis. The function of those three muscles are flexion of the shoulder and flexion of the elbow, one way or another. But just want to make sure that we understand the coracobrachialis has nothing to do with the elbow flexion. And so patient feels tenderness around here. We can go down here and feel that this is the tenderness is going to just radiate down here and also radiates toward the upper chest area. And here it shows that the nerve is going down. As it travels down, it is going to the forearm. This picture is a nice one for a reason that I'm going to explain to you why this is very interesting. As far as the coloration goes, it shows there's the blue color right here, and here's the pinkish color right here. This is in one nerve. That is the musculocutaneous nerve that we talk about that passes through that the small muscle right here that is called the coracobrachialis. And this nerve has the motor supply to those three muscles right here, but has no sensory input to the arm. But the nerve is going down and gives the supply here to the lateral aspect of the forearm. So if the patient feels pain right here, this is more musculature pain, more joint pain. Whereas as it goes down here to the forearm, it becomes cutaneous, more type of pain along the skin. And that is any type of paresthesia, referring to numbness, tingling, pain, and any type of abnormality of sensation can be seen one way or another due to the tightness of this coracobrachialis that the nerve is passing through. So I'm going to go back to the slide before. So if there is a tightness right here of this muscle due to the weightlifting or any type of shoulder activities that cause flexion and overdoing that, it causes this muscle to become irritated, becomes tight and spastic, and it causes this nerve to be very unhappy. And unhappiness of this nerve, it affects the motor system in the arm, in the front of the arm and the shoulder, as well as it is affecting the sensory below the elbow on the lateral side of the forearm. And so one thing that I would like to explain is that the motor system right here may not be affected at the beginning, but the sensory along the lateral side of the forearm will be showing some type of paresthesia, and in the acute case, because the sensory nerves can be affected before the motor nerves are being affected. So without having any motor deficit along the biceps or brachialis, you might see that sensory abnormality along the lateral side of the forearm. But again, the pain is right here, musculature joint, and that pain can radiate to the arm, to the chest, to the back of the shoulder. And again, it is very important to be able to diagnose that issue correctly. But again, a patient can have one area of the injury or could have multiple areas of the injury that is very commonly seen in the other accident, trauma, sport accidents, and so it will be affecting multiple areas, and that the clinician should be aware of the situation in order to give the best care that the patient deserves. And if you have any question, please contact us, CIC, Complete Injury Centers, and we will be more than happy to discuss and explain to you if you have any questions. You have a wonderful day.